so much we can be doing right now.
You're not doing it.
So now that we finished our subjective exam and our screening, we're going to be moving on to doing some tested measures. Does that sound okay with you?
It certainly does.
We're going to be doing some range of motion of your neck. The reason we're doing this is because of that car accident you had about 6 months ago. When you had whiplash, I think maybe you've compressed a nerve. And so when we do these range of motions, let me know if you have any reproduction of symptoms, any tingling, either like in the neck itself or like down in your left arm. Let me know if you experience any of those.
Okay, I can do that for you.
Alright. And then what'll happen is I'll explain the motion for you, and then you'll go through the motion, and then at your end range, I'll just have you pause, and then I'll take a measurement here with my goniometer.
Alright, sounds good.
Alright. So I'll just get lined up, or first I'll explain the motion to you. So we'll be doing the flexion face, which is basically tucking your chin to your chest and then letting your head fall. And you want to make sure that you're not moving your shoulders at all or rounding your back. All the motion should be coming from your neck.
Okay.
And then I just ask that you let me get lined up here with my goniometer first. And then I'll let you know when you're ready to move. Alright. Whenever you're ready. Is that it? Okay. 28 degrees of flexion. And so now we'll just be doing the opposite. How far can you look up towards the ceiling?
Okay.
And same thing, try to not move your back at all.
Sounds good.
Whenever you're ready. About 30 degrees of extension. Okay. So now we're going to move on to how far can you bend to the side. So what this is moving your ear down to your shoulder.
Okay.
So it'll look like this.
Okay.
And you want to be careful not to twist your head or anything like that. You just want to be looking straight ahead and just let your ear go down to your shoulder.
Okay.
Alright, and before we do this test, I just have to find a landmark real quick, just so I can align my goniometer better. So, is it alright if I touch the back of your neck to find a vertebrae?
Yeah, that's fine.
Okay. So I have my finger on a couple different vertebrae, and I'm just looking to see which ones move. Okay, found it, it's right. Alright. So whenever you are ready, you can bring your left ear down to your left chest, or left shoulder, I mean. Alright, you got 15 degrees. You can go back to normal. And just like I said before, if you feel any pain or anything, just let me know as we're doing these.
Okay. Yeah, I didn't feel anything with that one.
Okay. So now can you go down to the right, please? Alright.
Alright, I'm starting to feel, shooting pain, like numbness down my left arm, on my
Okay.
fingers.
Yeah, you got a little bit less range of motion, and this makes sense because as you're moving to the right, you're stretching out the nerve. So in our next test, we're going to be doing rotations.
Okay.
So I would expect you to also have a little bit of pain as you're looking to the right.
Okay. Let's see
So
what happens.
we can start out going to the left, and I'll just need to be above you to take these measurements.
That's fine.
So you just want to make sure that you're not moving your shoulders at all, that all the motion is just coming from looking to the left.
Alright.
You don't want to turn.
Like I'm stuck in the sand.
Exactly. Alright, whenever you're ready, you can look to the left. You got about 35, and you can look back straight ahead. And now, can you look to the right, please?
Just about right there. I'm starting to get a little bit of symptoms again.
Okay,
Right down
yeah,
the arm.
that makes sense. You got a little bit less, about 32 degrees.
Okay.
Yeah, that's basically the reason you're getting these symptoms is when you're looking to the right side, you're stretching out the nerve that's going down into your left arm.
Okay. Got it.
test. I think that one of your nerves is tight, and that's why you're getting these reproduction of symptoms when you're performing tasks.
Mm-hmm.
So this test is going to be a passive test, which means I'm going to take care of the arm motions for you. But what I need you to do is to make sure that your arm has its palm up. And then I'm going to ask you to move your head to the side, like we did before with the range of motion. So I'll come around behind you, and what I'll be doing is I'll be pushing down on your shoulder and lifting your arm up, and just let me know if you feel any symptoms while we're going through this range of motion.
And which side do you want my neck to bend?
Yeah, so your neck will be going to your right.
Okay, makes sense.
Palm up, and neck to the right. So I'm going to push down and pull your arm up.
All right, I'm already feeling.
You're already
Yep.
feeling it?
Oh yeah.
Okay, so I won't go any farther then.
I feel like there's something tugging in my skin, and it's like it's really hard to explain, but it kind of goes away. I have to kind of like rub it out, like it's right in these two fingers,
Okay.
predominantly, and it kind of has like a lasting, like almost like burning sensation a little bit.
A little numbness and tingling too, or
Yeah.
is it just like
It's like a
pull?
little, just a little bit of that, but
Okay.
mostly it's like a tugging feeling from inside. It
Okay.
doesn't feel like anything else I've felt before.
Okay, so it definitely is a neural tension issue.
Is that what it feels like?
Yes.
Oh, okay.
That'll be what it feels like.
All right.
Next test, we're going to be trying to determine what spinal root is compressed, and in order to do that, I'll be touching various areas on your arm,
Okay.
and you'll let me know if you can feel it or not.
Okay.
And these are specific areas to specific spinal nerve roots, and we'll determine which one it is.
Sounds good.
So if I could have you roll up the sleeve on your left arm, please. Alright, so I'll show you what it'll feel like with your eyes open,
Okay.
and then I'll ask you to close your eyes and we'll do it. So first we'll start on the left arm because you have full sensation in that arm.
Okay.
So what I'll be doing is just a quick little light touch like that,
Okay.
and then you'll just say you can feel it or not.
Okay. Yeah, I felt that.
Yeah, and if you don't feel it, obviously you won't say anything.
Yeah, definitely.
Okay, so if you could close your eyes.
Mm-hmm. Yes. 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 Mm-hmm. Mm-hmm. Yep.
Okay, you can open your eyes. So it's definitely a compression of the spinal nerve root C7. That's your middle finger in the back of your arm. And when I tested all those areas, you couldn't feel any of them.
Oh, wow. That's a news flash. Holy cow.
Yeah,
Okay.
don't worry. In therapy, we'll work on it, and we can definitely help out with these symptoms.
Okay. Awesome.
So now we're going to be doing palpation of your neck.
Mm-hmm.
And basically, because we think that you're having pain down your arm, but you had that whiplash accident, I think it's stemming from your neck. So what I'm going to do is come around behind you and then feel the spinous processes of the vertebrae on the back of your neck. Basically just moving them around a little bit and seeing if it creates any numbness or tingling or pain or any reproduction of those symptoms.
Okay.
Does that sound okay with you?
I do.
Alright. So first, you can relax your head down. I'm gonna start up high and find your C2 spinous process. And then I'm just gonna move down, and if you feel any symptoms, let me know. I'm just gonna name it when I move to a new segment, and I'm gonna go from your spinous process to your transverse process at each segment, and like I said, let me know if you feel anything. So I'm just going to walk down, alternating hands. C2, C3, C4, C5, C7.
It's a little bit weird sensation there. Not sure.
A little bit when I moved out to the side.
Yeah,
Okay.
it's almost really local.
Okay. Anything when I move farther down around T1 and
I mean, it's
out to the side on there?
it's there, but it's not as bad.
Okay.
Definitely worse than whatever one you're on above that.
The one above that?
Yeah.
Okay. Okay. You can scoop down a little bit. So, definitely compression of the C7 nerve root. And